and awards to his credit. With more than 16 years of professional experience as a specialist, Sir is currently holding the post of Professor and Head of the Dental and Maxillofacial Surgery at Amala Institute of Medical Sciences, Thrissur. I would like to welcome you, sir, to deliver your talk.
Thank you. Thank you for the brief introduction. Good afternoon to all of you. I'm Dr.Siji, as she's already introduced. So I would like to thank the organizers, especially Dr. Chiramel sir and Dr. Suleiman who consistently told me they have to go into the stage, and he suggested my name to Dr. Viraj. And I'm a bit nervous because I'm first time I'm speaking in front of such an international crowd. That doesn't mean that I'm not considered till now, but like your students are always more, towards more inclined towards scientific topics as you are still learning. Most of the clinical practitioners, I mean, most of them, not all, they are stop reading or they're not very much updated. So I know that you all are very much updated. So because of that, I'm a little bit nervous. And today I'm talking about a different topic. It's not from dentistry, but it is going to be a part of dentistry, and it's almost a part of dentistry because it's dealing with head. So it's on hair transplantation. I'm trying to give a brief idea about the procedure, the patient selection. I'm not going to show you much cases before and after because a lot of people you must have seen having the hair transplantation done. So let's go into the topic. So all of us like to see the stars with a lot of hair, right? Because hair is supposed to be a very important aesthetic question. But not for all, because personally for me, I also don't consider like hair because you can see my head. You must be thinking why I'm talking about hair transplantation and I'm not going for it. It depends on individual choice, and I'm still searching for a good place where I can go and get it done. So let's move on. So this is a lot of famous personalities they have undergone hair transplantation. You must be knowing this guy. So coming on to the introduction. So it's a very distressing for a lot of youth. Youth in the sense, especially for the age group between 20 to 35 years. So they are losing hair at a very young age. So hair transplantation is the only permanent solution. But only provided you should have a very good donor area so that your hair can be transplanted from that side. 85% of males and 40% of females are affected by female or male pattern baldness. So it's a surgical technique wherein we harvest cells. I mean, they are basically skin graft. We are not plucking the hair and planting it in some other place. Basically, we are extracting the skin graft, having the hair follicle, bit of dermis, epidermis, and fat. So we are basically taking minor skin grafts, harvesting the skin grafts from the donor area, especially from the back of the head, where the testosterone or hydroxy testosterone is not affected. So usually we are taking the graft from the donor area and trying to transfer it in the bald area. So these are the indications. Why I put this slide is not all can undergo hair transplantation with some people having some immunosuppressive disorders like alopecia areata. For such patients, hair transplantation will not work out because they don't have any viable cells over there. So these are the categories wherein you can go in for hair transplantation. Androgenic alopecia, the female pattern androgenic alopecia, then cicatricial alopecia, then facial hair transplantation. People who want to have a very thick beard or bush, they can go in for that. So coming on to the brief anatomy, you all must be knowing the scalp. That is the first thing what we learn in anatomy in our various days. So our area of interest is the scalp. So you should be knowing the brief idea brief anatomy about the scalp. When you're trying to transplant the hair follicles, you are not supposed to damage any existing hair follicles over there. So you must be knowing what direction it's coming up. So I'll be coming into that detail. So this is the growth cycle. Normally, it will take around 6 months. Maybe the healthy hair will be staying on your scalp unless you are infected by this androgenic alopecia. So these are the four stages: the anagen, catagen, telogen, and exogen. So there are a lot of drugs available in the market now which can prolong these stages. For example, finasteride, that is an anti-androgenic tablet. Then minoxidil, that is an anti-hypertensive medicine, which comes in the liquid form. So what they were initially minoxidil being used as an anti-hypertensive. They found that the side effects of this drug as hair growth. So right now they are using it only for hair growth, not for anti-hypertensive purpose. So we have a lot of androgenic receptors below the hair follicle, especially in the crown region. Crown region is this region. So this testosterone is getting converted into dihydroxytestosterone. So the drugs which I earlier mentioned is acting upon this stage so that they can retard the hair fall, so that the new hair start coming and the hair fall can be retarded. So your scalp will be having a feeling of lot of hair. So the key points in patient selection versus diagnosis. I'll be coming on to the Norwood classification in my next slide. So age, any people above the age of 25 years are best candidates because we're trying to do a hair transplantation at an earlier age. You don't know, like even after we transplant, they will be having hair fall. Their natural health will continue to fall to a particular age. So they might feel that hair transplantation is failure. So the fact is, whatever hair we have transplanted will stay there. The natural hair, which is falling according to their age, on behalf of their age, that will go back, and only the hair transplanted hair will stay. So it's always better to go in for a person with above 25 years. Then you have to check the hair caliber, hair density. The donor site you have to check, and the degree of pattern. The next slide I was showing like up to the 4th degree of classification we can go for hair transplantation. The hair color. People with very fair colored scalp and dark hair. So we need more amount of hair to cover the scalp area because of the contrast. And the patient expectation is very important. Patient might be thinking that you look like Shah Rukh Khan or Salman Khan, but then we should give a realistic opinion, telling that it should look like what is your age. A 55-year-old guy cannot come and tell us like I want to look like 18-year-old. So it should be realistic. The hair pattern, the hair design, the design what you are going to give should be realistic. So this is the classification. As I previously told, up to class 4 in males and up to grade 2 in females, we can go for hair transplantation. So again, we have to avoid these patients with mental illness, unrealistic expectation, then broken hair, poor donor site, no thickness, scalp inflammation, and unexplained scarring, unusual hair loss pattern. So coming on to hair restoration, these are key areas which we have to concentrate. Usually the vertex, that is a usual area where the hair thinning occurs initially. That area you can leave. You have to restore the other areas. You have to recreate the hairline, the temporal triangles, the temporal points, and where we should start the hairline. So this is approximately, if you divide your face, a man with a proper hairline, you can see that the lower half, the middle half, the upper half, they are equal. So this is the place where you should start your hairline, not below that. Above you can take, depending upon the patient's interest, whether you want to take it up, but not below this. and show you the reason. So always you should start designing your hairline above your temporal muscle activity. So you can see in one of the pictures, like your temporal, I'm sorry, the frontal muscle activity. The frontal muscles, the insertion of frontal muscle. Above that, you should start your hairline, not below that. Below the insertion, if you start, your hairline won't stay there. You will prone to cause a lot of muscle injury and your hair follicles will not stay. And the person with properly bald hair, you have to make a point by drawing two lines, one horizontal and one vertical, and the point dropped from the middle, the corner of the triangle. So from there you can start your hairline. So these are the marking. You have a globular marking. The lateral canthal marking is E. A is the globular marking, and D is the temporal point. C is the temporal triangle. So roughly you can take around 7 to 10 centimeters from the globular point. And of course the design will not be like this. You can ask the patient whatever line they want, they can draw and tell you they want it like slanting or straight, or they want it like V shape. Only thing is for males, we have to give the sharp turns. For females, it's slightly around the corners. The only point is it should be above the frontal muscle activity. And it should be better, it should be above 8 centimeters or 7 to 10 centimeters. So these are the various, this is according to patient's interest. So you can get your hairline anywhere you want. Just stick to the guidelines and don't make it a straight line, slightly irregular to have a good natural look. So coming on to the donor side, you have to check whether the donor side area is thick enough to give you a good amount of graft. So this in this picture, this middle portion where you will be having hair on your back, but then above this middle portion and below this middle portion, there is not the safe areas to take the graft. So this is the safe area to take graft. So it's better to take around 15 to 20 graft from square centimeter, not beyond that, because that may give rise to thinning in the area. So pre-op, what you all have to do is like do a routine blood test to avoid any communicable disease or the patient is not suffering from any bleeding disorder. And patient, if he is hypertensive, he should take regular medication. And if he is on antiplatelets or anticoagulants, he should stop the medication because it's going to bleed. Scalp is having a very good blood supply. Because of that, you need to suspect a lot of bleeding. Now coming on to anesthetize the region, we cannot just simply anesthetize like what we do in oral cavity. We are supposed to give it tumescence. Tumescence in the sense we have to basically enlarge that area. So, for example, saline, we are mixing saline with lidocaine and with 1 ampere of epinephrine, 1:1000 ratio. So you are giving this tumescent solution with saline, so that the tissue region will expand. So saline is a very good tissue expander. Once the tissue region is expanded, all the hair follicles will be defined. You can see each hair follicle with your naked eye, or you can use a microscope. So tumescent solution is very important. This is a tumescent solution what we commonly use. We can use normal lidocaine, what we are very familiar with, what we use in oral cavity. Plus, you can use VK, so it will prolong the action, and saline for tissue expansion, and epinephrine for bleeding control. So, my next slide I'll be showing areas where you can give the feedback. So, you have a zygomatic or irritable condition wherein these key areas you can block, so that you don't have to go and inject on a lot of places. So when you are transplanting, that is the other side, that is the other picture wherein you can give in a wheel-like pattern. So basically we have two techniques. One is FUT and other is FUE. This is follicular unit transplantation, that is follicular unit extraction. In follicular unit transplantation, we take a strip of skin along with the hair follicles. This has been not done much these days because you need very good technicians to just segregate the hair follicles from this thin strip. But only advantage is faster than FUE. But this will create a lot of scarring. This is how you transect the hair follicles from the skin strip. Shorter operative, less transection, less of learning. Now coming on to FUE, this is the most common technique that is being followed these days. The good thing is you can individually remove each hair follicle, but the problem is that the direction in which if you're removing the hair follicle is not right, there are chances of getting the healthy hair follicles to get transected. That is what I earlier showed you in FUT. Transection rate is less, but here transection rates are more. Only thing is you have to focus on the angulation of the hair follicle. Depending upon the angulation, you have to change your instrument. Basically, we take from the occipital region, leaving a thin strip above. This is a safer side. So after scarring, there will not be, after healing, there will not be much scarring. So this is how we are going to transplant the area. We have low, medium, and high, depending on the thickness the patient wants. So these are the advantages. So it's less complicated when compared to FUT. And only problem is healing time is also very less. Dressing is very easy. Patient will be very comfortable. So you need to have a very good team. Surgeon should be there, hair technician should be there, operating nurse and the operating operating. Armamentarium is a very similar thing what we are commonly using. You should have a lap micromotor or a straight hand that we usually use for impactions. Then we have a lot of punches starting from 0.8, 0.9, then 1 millimeter, then 1.2, depending on the size of hair follicle. So the graft, sometimes the graft will be having a single hair follicle. Sometimes there will be 2 or 3 multiple hair follicles will be there in one single graft. So depending on the size of the graft, what you are going to take, you can decide on your punches. So you call it as punch. So you have from 0.8 to 1.2 millimeter punch size. Then we need extraction close-ups. If you can pull in the hair follicle, and you have close-ups for transplantation. You need to have a good lighting. You need to have a good relaxing chair. A dental chair is enough. So this is how you make the punch hole, and you have to pull out the hair follicle. The hair follicle will be looking like this. So you have dermis, epidermis, then the hair bulb, as well as a bit of subcutaneous fat. And you are supposed to store that. You have to count it and store it in cold saline. It's better to have what do you say, like in your microbiology lab, you must have seen this glass tablet dish. You can use this glass tablet dish with cold saline, and you can keep a piece of gauze. You can arrange it in a group of 10 or 50 or whatever size you want. That will help you later during your transplantation time. And basically, you should supposed to store this only for 3 hours. 3 to 4 hours. More than that, graft viability is questionable. Graft will not survive. You go in for more than 4 hours. So you should finish your harvesting in 4 hours and start transplantation immediately. Then again, the areas of transplantation. The 1H region is the maximum concentration. Below that is the 2H, the 3H, vertex. You can avoid. The patient is very particular, and if there are graft, you can graft in that. You transplant that area also. But that is the least given. Some people they must have lost only in the vertex region. Such people, yeah, of course, you can go for the vertex. But vertex, it's difficult to say because that is a more pressure feeling area while sleeping or while lying down or something like that. So the graft viability is questionable in that. So basically there is two directions. You can either go perpendicular to the midline or you can go parallel to the midline. Parallel to the midline is more acceptable. So that is the way the hair is placed on our scalp. So you can go in for the parallel thing. This is the immediate result how you are going to place in the graph. It will be like there will be a thin white color above the top of the graph. Then after 2 or 3 days or maybe after 1 week, that is the appearance. Hair follicle will start growing. But after 2 weeks, it will start shedding. Then it will take another 3 to 6 months for hair to grow back. So these are the results roughly. So it will take around 2 months for the full growth of hair. So coming on to the complications. The basic complications are edema, bleeding, and the growth and aesthetics like hair transplantation failure can be complications. But in my setup, what I have usually encountered is folliculitis and shock loss. Those are two things what I encountered during hair transplantation. This is folliculitis. This patient had severe folliculitis. He almost lost 50% of the graft, which I revived after giving him valacyclovir. Valacyclovir 500 mg TID I had given for 2 weeks. Then patient became better. Because none of the antibiotics worked initially, so I suspected a viral infection and I went into valacyclovir. This is shock loss, again same patient. Luckily, I could get all complications in the same patient, so that I didn't go. I had to go in for another picture. So this is shock loss. So this side we are not supposed to remove hair follicle. Even though I didn't remove hair follicle, I removed hair follicle below this level, but because of lack of blood supply and injury to the blood vessels, that region, this region suffered a shock loss. This is reversible. Patient was worried initially. Only thing is you have to reassure the patient. So after I think within a month, growth restarted, and I was okay as well as the patient. This is again transplantation being done in a scar tissue. Usually it's contraindicated because scar tissue doesn't have very good blood supply, but it bleeds, deadly bleeds. But you can really go in and do transplantation. Usually we get patients with cleft lip and palate. I mean, the cleft lip people will be having a scar in this region, so we have transplanted in that region. So this is like this technique, wherein we are taking a piece of tissue from the hair region, trichological tissue, and we are isolating epidermal and dermal cells. We are culturing it. On the cells multiply, we are again removing the cells and injecting it into one area. This is still under process. Researches have been going on. We are planning to start in our institution as well. But they are still doing stem culture only for what is it, cancer patients. We have to start for this also. So to conclude, it's a very powerful tool for patients who are affected with androgenic alopecia, and this is our only permanent solution. This is my key article. To the reference. Thank you. Any questions from the crowd are welcome, because I know that I went on quite fast through my presentation.
Thank you, Dr.Siji. It was quite an informative session. Thank you for the effort. A few questions. Quite a lot of practitioners are into hair transplant, and what's your take on the PRP and all those? I mean, what is your take on it? Because
PRP is a very good tool. Like, it's very easy also. We can do it in our clinic itself. The only thing is you should have a centrifuge and you should have some PRP tubes as well. Or you can use the normal LCD tubes that we use for collecting blood in the lab.
no, compared to your transplant, what do you
For example, if you might have an example, for me, PRP not going to be very effective, but I can have a better, a little bit of thickness I can increase with PRP. Not, I will be getting very venous type of hair, that is short hair. Active hair growth won't be there. Only thing scalp look little bit thin. But for young people, like for age group of around 20 to 30, therapy is very effective.